The introduction, a welcome. Today, we're diving into a specific type of glaucoma called angle-recession glaucoma. Glaucoma, in general, refers to a group of eye diseases that damage the optic nerve, the vital cable connecting your eye to your brain. Angle-recession glaucoma is a unique form because it's usually caused by trauma to the eye. It can develop years after the initial injury, making early detection and understanding crucial. Join us as we explore the causes, how it affects the eye, how it's diagnosed, and what treatment options are available. Etiology, a causes. The primary cause of angle-recession glaucoma is blunt trauma to the eye. This trauma can be from a variety of incidents, such as a sports injury, a fall, or even a car accident where the eye sustains a significant impact. The force of the blow causes a tear or separation within the structures of the eye's drainage angle, specifically between the ciliary body and the iris root. While any significant blunt force trauma can potentially lead to angle recession, the severity of the impact and individual anatomical factors play a role in determining whether glaucoma will eventually develop. Pathophysiology. To understand how angle-recession glaucoma develops, we need to look at the eye's drainage system. The drainage angle, located where the iris and cornea meet, is responsible for allowing fluid called aqueous humor to drain out of the eye. When trauma occurs, the ciliary body, which produces the aqueous humor, can separate from the iris root. This separation is called angle recession. This recession can damage the trabecular meshwork, the spongy tissue responsible for filtering the aqueous humor. Over time, this damage impairs the eye's ability to properly drain fluid. The buildup of fluid increases the intraocular pressure IOP inside the eye. Sustained elevated IOP damages the optic nerve, leading to the gradual loss of vision characteristic of glaucoma. What's insidious about angle-recession glaucoma is that the damage to the trabecular meshwork might not cause immediate pressure elevation, and it can take years, even decades, for the glaucoma to manifest. Epidemiology. It's difficult to pinpoint the exact prevalence of angle-recession glaucoma because it often goes undiagnosed for years after the initial trauma. However, studies suggest that a significant percentage of people who experience blunt eye trauma will develop some degree of angle recession. Not everyone with angle recession will develop glaucoma, but the risk is significantly increased. Factors such as the severity of the initial injury, age at the time of injury, and pre-existing eye conditions can influence the likelihood of developing angle-recession glaucoma. The onset of glaucoma can occur at any age following the initial trauma. Signs and symptoms. In the early stages, angle-recession glaucoma often presents with no noticeable symptoms. This is why it's sometimes called the silent thief of sight. As the condition progresses and the optic nerve damage worsens, individuals may experience gradual peripheral vision loss. This loss of peripheral vision is often subtle at first and may go unnoticed until it becomes significant. In advanced stages, patients may notice blurred vision, difficulty seeing in low light, and eventually central vision loss. Because the symptoms are often subtle and gradual, regular eye exams are crucial, especially for individuals who have a history of eye trauma. Diagnosis. Diagnosing angle-recession glaucoma involves a comprehensive eye examination. This includes measuring intraocular pressures IOP using a tonometer. However, IOP alone isn't enough, as some individuals with angle recession may have normal IOP. Gonioscopy is a crucial diagnostic procedure that allows the eye doctor to directly visualize the drainage angle and identify any recession. The ophthalmologist uses a special lens to examine the angle structures. Other diagnostic tests include visual field testing to assess peripheral vision loss and optical coherence tomography, EOCT, to evaluate the optic nerve for damage. A thorough patient history, including any past eye trauma, is also essential for making an accurate diagnosis. A classifications typus. While angle-recession glaucoma is primarily defined by its cause, the severity and timing of onset can vary. It's generally considered a secondary open-angle glaucoma, meaning it's caused by another condition, see in this case, trauma that affects the drainage angle. Some classifications may distinguish between early onset and late onset angle-recession glaucoma, depending on how quickly the glaucoma develops after the initial injury. The extent of angle recession, as observed during gonioscopy, can also be used to classify the severity of the condition. Treatment and management. The primary goal of treatment for angle-recession glaucoma is to lower intraocular pressure and prevent further damage to the optic nerve. Treatment options include eye drops are often the first line of defense. These medications work to either decrease the production of aqueous humor or increase its outflow. Laser trabeculoplasty can be used to improve the drainage of fluid from the eye. This procedure uses a laser to stimulate the trabecular meshwork and enhance its function. In some cases, surgery may be necessary to create a new drainage pathway for the aqueous humor. The most common surgical procedure is a trabeculectomy, which involves creating a small flap in the sclera, the white part of the eye, to allow fluid to drain into a bleb beneath the conjunctiva. Glaucoma drainage devices, also known as tube shunts, can also be implanted to provide an alternative drainage pathway. Regular monitoring of IOP and optic nerve health is essential to ensure that the treatment is effective and to make adjustments as needed. At prevention, while it's not always possible to prevent eye trauma, taking precautions to protect your eyes can reduce the risk of developing angle-recession glaucoma. Wearing appropriate eye protection during sports activities, especially those involving projectiles or physical contact, is crucial. Using safety glasses or goggles when working in environments with potential eye hazards, such as construction sites or workshops, is also important. Seatbelts should always be used when driving or riding in a vehicle to minimize the risk of eye injury in the event of an accident. If you experience any blunt trauma to the eye, it's essential to undergo a comprehensive eye examination to assess for any damage and to monitor for the development of glaucoma in the future. A prognosis, recent research, or advances. The prognosis for angle-recession glaucoma varies depending on the severity of the condition, the age of the patient, and the effectiveness of treatment. With early diagnosis and appropriate management, it's often possible to control intraocular pressure and prevent significant vision loss. However, in some cases, the glaucoma may progress despite treatment, leading to progressive vision impairment. Recent research is focused on developing new and more effective treatments for glaucoma, including new medications, minimally invasive surgical techniques, and gene therapy approaches. Studies are also investigating the underlying mechanisms of optic nerve damage in glaucoma to identify potential targets for neuroprotective therapies. These advances offer hope for improving the long-term outcomes for individuals with angle-recession glaucoma and other forms of glaucoma.